Good day to everyone. So for this time video lesson, it's all about Health Grade 10, Health Services Quarter 1, Week Number 2, Health Professionals, Healthcare Facilities, and Health Insurance. Ano nga ba ang health services? Health services are often connected to healthcare. These programs aim to appraise the health condition of individuals through screening and examinations, cure and treat disorders, prevent and control spread of diseases, provide safety, emergency care and first aid, and ensure a follow-up program for individuals who have undergone treatment. So there are three types of health services. Number 1, we have health professionals. Next, we have healthcare facilities. And number 3, health insurance. What do you mean by health professionals? If we say health professionals, those are individuals who are licensed to practice medicine and other allied health programs. An example of a health professional is a physician, and a physician records the medical history of individuals, provides diagnosis, performs medical examination, and prescribes medication. Now, there are two types of health professionals. What are those? First, we have healthcare practitioner. Healthcare practitioner is an independent healthcare provider who is licensed to practice on a specific area of the body. Like for example, we have dentists, optometrists, neurologists, and pediatricians. Allied health professionals is a trained healthcare provider who practice under the supervision of a physician or a healthcare practitioner. So ito yung mga nagiging katuwang ng mga healthcare practitioners. Sila yung mga nurses, dietitians, pharmacists, and physical therapists. Now, here are some examples of physicians or doctor according to their specialization of field. Sa heart, we have cardiologists. Of course, sa children, we have pediatrician. For female reproductive organ, we have gynecologists. For senior citizen, we have geriatrician. For pulmonologists, for lungs, we have pulmonologists. For male reproductive system, we have urologist. For eye, we have ophthalmologist. For brain, we have neurologist. For skin, we have dermatologist. And for digestive system, we have gastroenterologist. Another type of health services, we have healthcare facilities. Healthcare facilities are places or institutions that offer healthcare services. Ano-ano nga ba ang healthcare facilities? Meron tayong hospital, walk-in surgery, health center, and extended healthcare facilities. There are different types of healthcare facilities. First, we have hospital. Hospital, it is an institution where people undergo medical diagnosis, care, and treatment. A hospital offers different types of medical care like inpatient and outpatient care. If we say inpatient, care refers to care given to individuals who need to stay inside the hospital to receive proper treatment, monitoring, and care. So sila yung mga individual na nako-confine at nag-i-stay sa hospital para mag-undergo ng treatment. Ang tawag po doon ay inpatient. And outpatient care naman, ito naman yung refers to treatment that does not require an individual to stay inside a hospital. For example, may mga minor cough or fever. So, ang ginagawa lang ng mga outpatient ay nagpapa-check up. Then afterwards, raresetahan lang sila ng mga doktor na nandoon sa hospital. So, ang tawag sa kanila, outpatient. So, hindi na nila kailangan mag-stay sa loob ng hospital or ma-confine sa hospital para sa treatment. Now, there are different kinds of hospitals. Number 1, we have private hospitals. Second, we have voluntary hospitals. Third, we have government hospitals. And fourth, we have teaching hospitals. Ano-ano nga ba itong mga hospital na to? Number 1, we have private hospital. It is operated by individuals or organization to gain profit. Ang purpose ng hospital na private ay magkaroon ng profit or income. Kaya sila nagtayo ng hospital ay para kumita. So, asahan natin na sa mga private hospital, talagang matataas ang singil or matataas ang bayad. Okay, ang example po nito yung mga St. Luke's Medical Center or Asian Hospital, Makati Medical Center, Bernardino Hospital, Nodada Hospital. So, sila yung mga example natin sa private hospital. Next, we have voluntary hospital. Voluntary hospital does not require profit because it is owned by a community or organization. So ito naman, pinapatakbo ng mga organization. Sa Pilipinas, iilan-ilan lang ang voluntary hospital. Actually, galing pa sa ito yung mga galing sa foreign aid na pinoprovide sa atin para makatulong sa community. Example nito, dati meron tayong natawag na Association of German Doctors. Diba? So yun yung example ng voluntary. Yung mga German doctors, nagbo-voluntary sila na pumunta sa hospital just to help the community. Okay? Para magbigay ng treatment. Okay? Next, hospital coming from foreign aid also is an example of voluntary hospital. Another type of hospital is a government or public hospital. So a government or public hospital is being run by the state and the treatment fees are subsidized. Okay? So sa public hospital, hindi ganong kalakihan or kataasan ang binabayad. Kaso nga lang, syempre, since it is public, mas maraming pumupuntang mga patient kasi nga mas mura. So yon. So example natin yan, we have Philippine General Hospital, Lung Center of the Philippines, and East Avenue Medical Center. Next, we have teaching hospital. Teaching hospitals includes a school for medical students. Ito yung mga eskwelahan na nagtatayo ng hospital kasi yung eskwelahan nila, nag-o-offer sila ng medical courses. So, ang ginagawa nila, para mas makatipid, gumawa na lang sila ng hospital para doon i-practice yung mga natutunan ng mga doktor. Okay, na nag-aaral sa kanilang eskwelahan. So, ito yung example. We have UST Hospital, FEU, and RMF, Bicol Regional Training and Teaching Hospitals. So, intended po talaga siya sa mga medical students. Pero syempre, supervised pa rin po sila ng mga professional, mga doctors, mga expert doctors. Okay? So in the Philippines, there are only two classification of hospitals. So we have general hospitals, have completed medical, surgical, and maternal care facilities. Ito yung kompleto facilities. Pag sinabing kompletong facilities, consider po siya as general hospital. Okay? So, hindi na po kailangan lumabas para magpa-sked ng laboratory kasi nga nandoon na lahat sa general hospital. So, example niyan, Philippine General Hospital, Baguio General Hospital, Cebu General Hospital, and Davao Medical Center. Next, we have specialty hospital. Specialty hospitals handle a particular disease or conditions to deal with only one type of patient. Okay? So, ito, yung mga hospital na to, specialized lang siya dun sa uri ng sakit. For example, Philippine Heart Center, nakapokus lang siya sa heart. Pero may mga patient din na, syempre, hindi lang puro heart disease ang nakakonfine doon. Okay? Sa Lung Center of the Philippines, ganun din, National Kidney Transplant Institute, so more on about naman sa kidney. Okay, taking care or treatment on kidney. Okay, so yun yung mga hospital wherein specialized in a certain disease or certain part of the body. Okay, next, health services, we have walk-in surgery. Walk-in surgery center is a facility that offers surgery without the patient being admitted in the hospitals. So yung walk-in surgery, sila yung gumagawa ng mga minor surgery at hindi na kailangang i-confine ang pasyente. Example nito yung mga circumcision clinic. Yan. Diba pagkatapos ma-circumcise, pinapauwi na ng doktor, hindi na kailangang mag-stay sa Hospital. So, ang tawag po kasi doon sa kanila, doon sa mga center na yun or clinic na yun ay walk-in surgery. Next to walk-in surgery, we have health center. So, health center, the service in a health center cater to a specific population with various health needs. So, ito naman, ang example nito yung mga barangay health center. Okay? Extended healthcare facilities. Extended healthcare facility is a facility that provides treatment, nursing care, and residential services to patients, often the elderly. So ito naman yung mga pinoprovide sa residential area or taking care, especially sa mga senior citizen. So example yung mga private nurses and caregivers. Ang tawag po doon ay extended healthcare facilities. And last, health services. So we have health insurance. Health insurance is also considered as health services. Ano nga ba itong health insurance? Health insurance is a financial agreement between an insurance company and an individual or group for the payment of healthcare costs. Okay? This also may pertain to a protection that provides benefits for the sickness and injury. Sa ibang bansa, kailangan talaga na meron kang health insurance. Kasi pag nagkasakit ka, ang sasagot yung health insurance. Sa ibang bansa, priority nila ang health insurance kasi nga, they took care of the health or priority nila yung health ng isang individual. So health insurance also offers various types of coverage like medical insurance, major medical insurance, hospitalization insurance, surgical insurance, and disability insurance. Medical insurance pays for the fees of the health professionals, laboratory tests, and prescription drugs. Major medical insurance offer payments for long-term or chronic disease such as AIDS and cancer. Ito yung mga example of health insurance dito sa ating, sa bansa natin. We have, of course, yung pinaka-popular. So, nagkakaroon ng issue sa ngayon. We have the PhilHealth. Then, we have the Medicare or health insurance. Ayan, IntelliCare, MedAsia, Medicare, PhilCare. So, ayan po, Coco Life Healthcare, ValueCare. So, sa atin, ayan po yung mga health insurance na nag-grant ng nag-grant po ng mga benefits, especially kung halimbawa magpapalaboratory tayo. Siyempre, nahinuhulugan na po yan monthly sa ating salary. Binabawas na siya. So therefore, pag nagpa-check up tayo, sagot na ng insurance. Okay? So yun po yung ating tatlong health services. We have health professional, healthcare facilities, and health insurance. Thank you po sa panonood. I hope that you learned something about health services.